Okay, this is from the continuation of the book review, Digestive Tuneup, the book by Dr. John Mcdougall. This is Dr. John Mcdougall's website. It's called drmcdougall.com, and this chapter is about diarrhea diseases. So it's part 7 of the book review. So the reason I show you this is Dr. Mcdougall has cured more patients than any doctor who ever lived, and he's got a whole bunch of testimonials. Dr. Mcdougall saw about 12,000 patients in his clinic, apparently. And what's his name? Kempner saw about 19,000. However, Dr. Mcdougall, when you include all his YouTube videos, all of his newsletters, all of his books, then he ends up having more patients than Dr. Kempner. So anyways, as far as diarrheal diseases, things like ulcerative colitis, Crohn's disease, irritable bowel syndrome, he's got lots of testimonials of patients who've been cured by this. By the way, I was a star Mcdougaller for weight loss many years ago. So anyways, that's our first slide. Okay, here's the second slide. We're going to be talking about these inflammatory bowel diseases. So basically, first of all, what's normal intestinal lining? The gut's also called the enteric tract, so the gut lining cells are called enterocytes. Site means cell, enteros for the gut tract. Okay, anyways, the fiber is taken by the good gut bacteria. They're drawn here with a smiley face, and they convert the dietary fiber into short-chain fatty acids. Most important one is butyrate. It's a 4-carbon fatty acid, and they use that butyrate, the enterocyte lining cells, they use it to make TJs. TJs are tight junctions. And the tight junctions keep these cells secured to each other so nothing unwanted can get across that barrier. Okay, and right immediately deep to the enterocytes, you have a bunch of immune system cells. The dendritic cells are like macrophage, big eaters, so to speak, and they sample what's coming into this area. Well, what happens is if a person doesn't eat enough dietary fiber, then they're not able to maintain these tight junctions. And then you have a gap in the intestinal lining cells. They're also called epithelial cells. And this is called leaky gut. It's another way of saying increased intestinal permeability. Now, the bacteria make endotoxins. LPS is the endotoxin for gram-negative bacteria. LTA is the endotoxin for gram-positive bacteria. Those endotoxins get across the barrier, and they can cause a lot of inflammation because the immune system responds to them right in the immediate sort of lamina propria submucosal area of the gut wall. You can even get entire bacteria getting across through these loose junctions. You'll also get molecular mimicry whereby big chunks of protein can get across the gaps in the tight junctions. Normally only a tripeptide is the biggest amount of amino acids together absorbed, but you can get big chunks of protein across these lac-tight junctions. And those protein sequences can mimic the protein sequences of proteins in the human body. That's called molecular mimicry. You can form antibodies to them, and they can cross-react with antigens on the human body. That's called autoantibody cross-reactivity. So the point I'm saying is once you've got leaky gut, it's sort of like all hell breaks loose, okay? You can get a lot of bowel wall inflammation as you do in ulcerative colitis, as you do in Crohn's disease. And it's not just a lack of dietary fiber that can cause leaky gut. It's also things that injure the gut wall. And it's also, a lot of chemicals. Alcohol can do it, F- and Cl- that are routinely present in tap water. You want the Cl- there to sanitize the water till it reaches your house, but once it's in your house, you want to remove that with a carbon filter is all it takes. Excessive psychological stress, caffeine, sleep deprivation, they cause a little bit of decreased blood perfusion due to vasoconstriction of the gut wall, and that could potentially worsen leaky gut. And there's a whole bunch of chemicals here. So if you've got an autoimmune disease, if you've got a gut problem that seems related to inflammation of the gut wall, avoiding all these things will help you have a better chance to reduce your symptoms. Okay, so this is just to give you the vocabulary. Now we're going to get into the text of the book on this topic. So diarrhea diseases like IBS, irritable bowel syndrome, inflammatory bowel disease. Inflammatory bowel disease will often, typically refer to ulcerative colitis and Crohn's disease. Mild chronic colitis is usually called irritable bowel syndrome. When you have both diarrhea and constipation, with episodes, they can have episodes of both diarrhea and constipation, and this is the most common cause of a referral to a gastroenterologist, about 50% of their visits. The most common causes of inflammatory bowel disease are milk, dairy, the lactose, sugar, wheat, eggs, high-fat diet. And this is on page 96 of the book, Digestive Tuneup by Dr. Mcdougall. So I have the page numbers here so you can follow along. For irritable bowel syndrome, the Mcdougall diet is usually a very good treatment. Inflammatory bowel disease is found only in people who eat a Western diet. Inflammatory bowel disease is more common in northern patients because they tend to eat more meat and dairy up north. Crohn's disease patients can have 20 bowel movements in a day, and they'll tend to find relief once they go on a Mcdougall diet within about 3 days. That's page 102. Offending foods for celiac disease include barley, kamut, rye, spelt, triticale, wheat, the subtypes of wheat, beer, malted drinks. Foods that are acceptable for celiac disease is they can do pretty well on rice, millet, oats, buckwheat, corn, quinoa, sweet potatoes, beans, legumes in particular, veggies and fruits. Patients with ulcerative colitis and Crohn's will greatly benefit from a low-fat plant-based diet. The best way to prevent and treat all forms of colitis from mild to severe is to eliminate all free fats. Eliminate all the vegetable oils and the animal foods. Yeah, I've heard Dr. Mcdougall give his video lectures, and he'll say the two major toxins in the Western diet are animal foods and vegetable oils. And I even heard him in another video say the biggest toxin in the Western diet is fat. Okay, and then, yeah, also I'm going to let you know, where does that come from? Pritikin was a genius, just like Mcdougall was a genius. Pritikin was a genius, and he went through all the literature on fat. He wrote quite a bit about it in his legacy book, which is available at the Dr. Mcdougall website. And he came to the conclusion fat is bad. The more dietary fat you eat, the more health problems you have. He even described something that he called lipotoxicity from the high-fat diets, how they were causing problems throughout the body. And so that's why you'll also hear me say fat is bad. There's none of this good fat stuff. There are no fats that you want to seek out. The small amount of fat you get from eating low-fat plant foods is all the fat you need, and that includes the essential fats, the omega-6 and the omega-3s. Okay, and he said persons should begin consuming a starch-based diet with fruits and vegetables, and if that doesn't work, some patients, most patients will do real well with that, but if some don't work, he says, then eliminate all the wheat products. And he has information on an elimination diet for patients with inflammatory bowel disease on page 102, going through page 104. So he goes through that. And you stepwise just eliminate one thing at a time to see if that's causing your problem and continue it for a while to give it a fair chance. So I think that's about it on diarrheal diseases. Yeah, that's it for diarrheal diseases. Hope that was helpful.